Global health experts now are predicting a huge spike in Ebola cases in the months to come. A World Health Organization official says there could be up to 10,000 new cases of Ebola per week within 2 months. But WHO is aiming to have 70% of cases isolated within 2 months to reverse the outbreak. That official also says the death rate in the current Ebola outbreak has increased now to 70%. Previously, the World Health Organization had said the death rate was closer to 70%. A critical care nurse in Dallas fighting the Ebola virus remains in isolation and in stable condition right now as the CDC tries to figure out how she got infected in the first place. Jay Gray with NBC has the very latest on what is being done right now to help her.
26-year-old critical care nurse infected with the Ebola virus while treating Thomas Eric Duncan before his death.
This is a tragic event, and the other member was crying with the mom, with the mother, and the whole church is just like in the shock situation. We really don't know what to do.
In the hospital where the first U.S. person-to-person transmission of the deadly virus took place, the staff and agents from the Centers for Disease Control are trying to figure out what to do as well.
All of us have to work together to do whatever is possible to reduce the risk that any other healthcare worker becomes infected.
Pham remains in isolation right now in stable condition. A part of her treatment includes blood plasma donated by Dr. Kent Brantley, the first American to survive the disease. Hazmat teams have been working to disinfect her apartment, and the city has taken special precautions to take care of her dog.
That dog will be the best cared for dog in the United States. This young lady is a hero, and she is concerned about her health and that dog. And we are going to take care of that dog.
While the staff at Texas Health Presbyterian does everything they can to take care of one of their own. Friends tell us that Pham is comfortable and being well cared for, and that she's even communicating with her family on Skype and in emails. Jay Gray, NBC News, Dallas.
Thank you, Jay. As concerns about Ebola in the U.S. rise, public health educators at IU are now talking about how they have trained and work with public health care workers in Liberia and know about the Ebola epidemic firsthand. They say there is so much hype about Ebola because it is so deadly, but they urge everyone to stay calm because guarding against Ebola infection is just like guarding against other deadly viruses.
Our ability to respond in Africa is directly related to our ability to stop emerging epidemics here in the United States. We have got to get comfortable going places, supporting them in their healthcare system, and stopping these diseases before they reach our shores.
And healthcare workers at Eskenazi Hospital showed us how they are now prepared to deal with infectious diseases like Ebola. They say it's not only important to wear protective gear, but also to be careful when you take the gear off so that you don't touch the contamination on the outside of the protective suit.